welcome back to Girl Talk. Girl Talk is a live stream call-in show, and the lines are now open. We're talking to Shelby, Women and Cancer. Feel free to call us at any time. Jump in, share your stories, ask Shelby questions. The number is 813-667-6666. So,
okay.
Shelby, so you were going to, in our break you were talking about, how to do the exam. So you want to...
Oh, okay. I wish I had my breast form with me, but... So I kind of.
We could be your best form.
I am not shy. Okay, about this. So a lot of women say, I don't know how to do my self-exam, or I don't know what I'm feeling. I have lumpy, bumpy breasts. I have cystic breasts, and I always say, go have your annual mammogram, and know that your lumpy, bumpy is normal, and do your monthly self-exam. Okay. So you want to do your monthly self-exam about a week to 10 days after your monthly cycle. Okay. Hormonally, normally your breasts are kind of sensitive, so makes sense. Hormonally, things will have settled down. So you can either do your self-exam in the shower, standing up, or lying down. A lot of women prefer to do it in the shower. They can kind of soap up. So you want to put your arm over your head.
Let's try it.
Okay, arm over your head. You want to take the pad of 3 fingers. Okay, so a lot of women, I'll say, show me how you do your exam, and they do this. And I'm like, wow, you just gave yourself...
That's what I do, too, is that.
And I just say, you just gave yourself a nice massage.
I've been massaging for a lot of years.
Right, okay. You're just kind of like, oh, that's a nice massage. But what you actually want to do is you want to take the pad of 3 fingers. You can either start in the center of your nipple, or you can work from the side. You can go round in a circle. So whichever. No, what you're going to do is, and I always start from the center, is you want to press as far to your chest wall as you can.
Okay.
All right. And you do like a rolling sensation, a rolling movement. Okay. But then what you want to do is you want to roll your fingers down. So see, I'm not lifting my fingers off the breast. Okay. And you're going to feel everywhere. Then you're going to come back up and make sure you cover every area of the breast. If you're doing this, or even think some women will do this, you are not going to feel.
Like under here.
We're going there too. Okay. So once you completely cover the area of your breast, you want to go around the edges of your breast and feel all the way around. You want to go feel into your sternum, above your collarbone, and up into your armpits.
I have been doing this so wrong.
Everybody has. I speak to women like 60, 70 years old, and they go, girl, I've been doing that all year or all my life. And no, they're doing it wrong. Okay.
Wrong.
This is your lymphatic channel here. Da-da, da-da, da-da. And just like we talked earlier, my breast cancer went straight to my lymph nodes. So if you feel a lump up here, if you feel a lump here, anything. Bottom line, if you feel a lump and you think it's suspicious, go get it checked out.
Now I'm sure I got this crazy look on my face like, I've been doing this so wrong.
Right. Going back to that whole, this controversy about mammography and stuff, wouldn't you rather know that this that you're feeling is not cancer, and that's just your cyst that is kind of, there's that cyst.
Normal, right.
And speaking of, the reason we say once a month, because I have women that say, I have this cyst, and they touch it every day. You will not notice a subtle change if you're touching something every day. That makes sense, doesn't it?
Yes.
So we say once a month.
Okay.
So entire breast. Another thing is you want to put your hands on your hip. You want to stand in front of the mirror, and you want to look for any orange peel texture, any dimpling of the skin. That's an indicator of inflammatory breast cancer. Very serious. Any nipple discharge, go get it checked out. So it's kind of...
So you're supposed to squeeze?
You can well, if you're having discharge, like when you do this or something, go get that checked.
Okay.
All right? Any orange peel texture, definitely go get it checked.
Interesting. I can't believe, I do them partially because of knowing you and so many other survivors, but I have been totally doing that wrong. I had no idea that you needed to go all up in the the collarbone and all that good stuff. So so who else has been doing it wrong? I know you guys don't necessarily want to talk about cancer, but call us and share someone else's story. Pretend it's not you. Call us at 813-667-6666 and find out, get some great information. Shelby is a wealth of knowledge here, and just kind of learn from what she's been through, because early detection really is the key. Yes, there we go. How about that? And they went away. That was quick and easy.
Okay, that was darn. We were ready.
We were ready, absolutely. So call us back. Maybe
Call
you
us
got
back.
disconnected. Did you hit a bad area? Can you hear me now? But so let's kind of talk a little bit about something fun.
Okay.
Let's talk about the bodies of courage.
All
Tell us
right.
about the bodies
What
of
is that?
courage.
Okay, well, I'm affiliated with an organization called Faces of Courage. And Faces of Courage is actually celebrating their 10-year anniversary this year.
Happy anniversary, Peggy and Ruth.
Peggy Sherry, my very good friend, she's founder and CEO. She's amazing, and she does free cancer camps for women and children with cancer. And there's our caller.
Yay. Thank you for calling Girl Talk. Hello.
Hi, yes.
Hi, who are we speaking with?
My name is Katya, and I have a question.
Yes.
I tried to call earlier, I couldn't get through. And so the question that I had for your guest is, I was watching you guys actually do the test, I guess, to touch your breast.
The self-examination, yes.
Yeah, so how far up are we talking about the self-examination? So how far up are we talking about in terms of around the neck? I guess to come all the way to the collarbone.
Right. What you want to check like is in the middle of your chest and your sternum, right above your collarbone, and then into your armpit. So right in your collarbone area.
So if we're talking collarbone, is it just where?
This is here's your collarbone here. So you want to feel above this collarbone. And there's lymphatics there. And so if breast cancer is going to spread, these are the channels that it goes to. So you want to make sure sternum, collarbone, and again, definitely into that armpit area.
Did that help you being able to see it?
Okay. Yeah, definitely. I didn't know because I'm a little bit concerned because I had two family members that died with breast cancer. That was really close to me. And been to the doctor, and it seems like I have some of my neck glands a little bit swollen. I did a mammogram as well as a sonogram, I think it is, and then also I did a PET scan. So trying to figure out why the glands are a little bit swollen around my neck and towards my collarbone area. So I need to follow up on that, but that's all I was asking. Where that was.
Okay. And so have you received your PET scan results already?
Everything was negative.
Oh, okay. Well, then that's good because your lymph nodes will swell up if you're fighting infection. So you might have an infection in your body. It could be anything from a cold. Just think like when you have a sore throat and it hurts to swallow, and you say my lymph nodes are swollen. That's because it's your body's infection fighting system. So there's a possibility, maybe there's something else going on. But if your PET scan came back clear, I would just breathe a huge sigh of relief because if it was something malignant in the lymphatic system, it would probably show up on that PET scan.
But should she do, how often should she do that again, or should she get a second opinion, or should she just...
Well, if you're not comfortable with where you're at, I always say go get a second opinion. I mean, that is definitely your prerogative and what you should do to make sure that you're on the road to wellness. But, I would get with your doctor again if those glands aren't settling down and see if there's something else going on.
Did that help you?
Yeah, definitely. No, I have a follow-up. I'm going to go ahead and see her and see what else may be going on with that. But at least it's not, as far as I can tell, not anything that has to do with the breast area, but... there may be some other issues going on.
Right. Yeah.
Well, hopefully... go ahead, I'm sorry.
I said thank you for answering my question.
You're welcome. You're
Thank
welcome.
you for calling in.
Thank you.
Have a good night.
And take care.
You too.
So see, going through that has helped someone. Because,
Right.
Again,
I didn't even know.
I've been doing the whole fidget great
Massage.
in the shower. Funny. Okay, so finish telling us about the bodies of courage.
Okay,
I definitely want to hear about it.
So Faces of Courage, they do free cancer camps for women and children with cancer, and part of a fundraiser effort, what they did is they actually body paint cancer patients. And it's not only breast cancer patients. It seems like a lot of the women that do the body painting are breast cancer patients. So I personally have done it. And so basically some women do it completely naked. I personally am not that brave. I think I'm a rock star, but I don't rock that.
Yes, that's funny.
And so it's there's an amazing artist, Lisa Shoulder, and literally she paints your complete body, front and back. I wish we could put a picture up.
Amazing.
If anyone's interested in seeing the art, go to Bodies of Courage. You can look at it on facesofcourage.com and then look at Bodies of Courage. So they're beginning to sell the artwork to help fund camp because the camps are free. And we have women and children that come from around the United States. And it's a 3D. I almost went 3D on my mind. It's a 3-day weekend, and it's canoeing and fishing and archery. I don't have the dates right now for this year. We're in the planning stages, actually, for camp coming up. And so the goal for Faces of Courage, though, is actually to have a year-round camp.
Which would be amazing.
And so,
It's here in Tampa.
It's
in Tampa.
Area,
Yeah, in Brandon.
Kinda,
Right now we meet at Camp Rotary in Brandon, but they're looking to obtain their own land, so they're working on different funding efforts to actually have camp year-round. It would also be like a self-sustainable camp and also a center to help people, men and women and children with cancer, whether it's arts and crafts, but also to give them skills to get back into the workforce after cancer. So we have lofty goals.
Yes, and it's a great organization. Again, it's who I selected as my beneficiary, so to speak, of my efforts in the month of October. But the other thing that I really like about this camp is, again, when you start talking about the fact that people don't want to talk about cancer. They don't want cancer. They don't want to talk about cancer. They don't want to talk about cancer. And and people, when you tell someone that you've got cancer, if they've never experienced it, they don't know what to say. Yeah. They don't know how to respond to that. So this camp is a place where everybody has kind of gone through this. They can talk about it. They can, they can relate to one another. And I've gone, I think, once or twice over to her facility, and I went once, and there was a group of women, and let me tell you what, these women rock out loud.
They do.
You do not want to mess with these cancer survivors because they have battled death. And they won, and they are a force to be reckoned with.
Yeah, this is true.
You also said, Shelby, you're sitting here talking, that there is a group, support group or something that you guys meet up and...
Well, I lead a breast cancer support group, so I do work for Florida Hospital in Tampa. Okay. That's where my cancer journey brought me. I started as a volunteer. They were building a new breast care center back in 2008. And I just felt like that's really where I was supposed to be. And so they ultimately hired me. I can't believe some of the things I've done in life since that. But I did start a support group. And goes back to, I believe everything happens for a reason. And so our support group meets the second and fourth Tuesday of every month at 5 p.m.
Where?
At Florida Hospital Tampa. So we're at 3000 Medical Park Drive. Okay. We're in the Life Hope building. It's open to anyone that's been diagnosed with breast cancer. They can either be in treatment or out of treatment. They don't necessarily have had to have treatment at our facility. We're open to anyone in the community. I have anywhere. Group is growing. Oh, we've got a caller coming in.
Hello, caller. Welcome to Girl Talk.
Hello. Hi. How are you?
Good. How are you? Who are we speaking with?
This is Sandra from Riverview.
Hi, Sandra.
Hey, Sandra.
What's your question, Sandra? We're ready for you.
This is a very important topic, and it really, I want to commend you for just being able to talk about it. And how breast cancer does affect a lot of women, but it also affects the family as well too. And I was watching, and you guys were talking about the different support groups that you have for the women. Is there anything out there for the families, like the children, the husbands, the significant others, family members?
Out
there for them?
Sandra, that's such a great question, and actually I was going to touch on this and exactly what you just said. When someone is diagnosed with breast cancer, and actually any cancer, it affects the entire family. It affects your relationships. When Kelly kind of touched on that, some people don't know what to say. It really affects you emotionally, spiritually, sexually, relationship-wise, in all of those aspects. But, you know, for me, you know, we tried to start a support group for caregivers, and surprisingly, we had no response.
Wow.
And so what I would suggest to you is the American Cancer Society. You can go on the American Cancer Society's website, and they list local support groups in the area. And there may be, I personally am not aware of a caregiver group. I would hope that there's one out there, because there's definitely a need. And because it's so important for those family members to be able to talk about the issues they might not be sharing with that person that's battling cancer. They might be too afraid to scare them with their own fears. Or you mentioned children. I think back to, you know, when my children were so young, and it affected them all so differently. My son was 8 years old, and he was so compassionate and concerned. And my daughter was 10, and, you know, she was developing breasts, and here her mother was having her breasts cut on and removed. And she really had a hard time even being around me. I have to say that. And it was hard. And my oldest daughter was getting ready to start college, so she didn't see a lot of it, so she didn't really understand everything that was happening. But it's so important if you have cancer in your home and you're needing, you know, support, I would either look for, you know, a licensed social worker or a counselor, or definitely check to the American Cancer Society website.
Okay, thank you so much.
Thank you.
Thanks for calling. Have a good night.
You too. Bye-bye.
Bye.
And that's so true. You know, your relationships change. And it's hard. It's so hard on the patient when they're fighting cancer. And my best friend, my longest best friend, could no longer be my friend. I've been friends with her since junior high school.
And what was the reasoning behind that?
I think it was just difficult for her to see me go through it. She was actually having augmentation and increasing her breasts, and I was going through all this cancer. And you know, we all have our choices in life, but I think it was hard, and it affected the relationship. And at the same time, as those relationships change, you have people that come out of the woodwork that you didn't really think cared about you so much.
Right.
And you gain new friendships. So what you lose, you gain.
Right, understood. I mean, I guess it's got to be pretty difficult when you're thinking about the fact that you're facing your own mortality. I mean, like you said earlier in the conversation, we're all going to go at some point, but I mean, it's almost like, it's like you've got a diagnosis that's almost got a date stamp on it. And I mean, and most of us, you know, it's...
Well, and here's the thing. Every single person, when they receive that diagnosis, you have cancer, you automatically think, I'm going to die. I'm going to die next week. I'm not going to be here. Right. But the fact of the matter is there are many of us surviving and thriving and continuing on to long and healthy lives. Right. And it's getting over that fear of realizing that it's going to be tough.
Right. Yes.
And a lot of us are going to survive. Some of us aren't. You know, but the majority are. And so I think once you can get past that, wrapping your head around that you have cancer, that you're in for the battle of your life, but you can battle it and you can come through it. And that's what's key.
Very cool. Well, I want to go back to kind of something that Sandra mentioned when you started talking about, because you mentioned your kids. Okay, obviously you're seeing how it's affecting them. How did you respond to, I mean, because clearly your daughter lives in the house with you. She's 10 years old. She can't avoid you forever. You know, so how did you handle dealing with what you were going through and trying to help them cope as well?
Well, even before that, how did you even tell them? How did you gather that courage to
Oh
even
my
tell
gosh,
them?
that was a difficult conversation because I had to gear it to what they could understand.
Yeah, at 7 and 10,
know.
I would imagine.
And then,
so.
but also, I really had no idea what I was in for. I mean, for me, my battle lasted 5 years. Wow. For most people, I don't want to generalize it, but when you receive a diagnosis of breast cancer, and depending on your stage, some women have a lumpectomy, bada boom, bada bing, they're done.
Right.
They're so fortunate. Some women go through chemotherapy and radiation, and they're done. And other women have complications. And so the battle is sometimes a few months. Normally it's a year to 2 years. and then you're ready to move forward and continue the healing. But so I really didn't know what I was in for. But when I saw how it was impacting them, I mean, there was definitely like where my daughter was starting to act out or pull away a little bit, is I became extremely sensitive too. I wanted to make sure my bandana was on because it bothered her to see me with no hair.
Right.
Whereas my son would say, Mom, take that bandana off, you're beautiful bald. So he had a different viewpoint.
Right.
You know, and I think for anyone battling cancer, you kind of have to tailor how you're going to interact with your children because they're just as unique
Yes,
as,
exactly.
you know, we're all
Yes,
unique
it's
individuals, and they're not going to handle it the same. When my daughter would come home from school, she didn't really comprehend the level of how sick I was. So she wanted to be that typical teenager, let's go shopping, Mom.
Right.
And I was sick, dragging butt, and throwing up in the bathroom at the mall. And it was
to-
fun with
yeah.
her, you know.
Right. She's like, you're losing weight.
Right. You're doing good, Mom. You know. But, you know, you as a mother, you know, you always, any mother battling cancer, you conserve all of your energy and you just try to continue to be that mom to your children.
And what about the spouse?
Well, you know, unfortunately for me, you know, I ended up getting divorced. And in the end, he said he wished he had someone to talk to. Going back to Sandra's point,
Yes.
is he didn't really communicate how he was feeling. And as I was getting better, he was checking out. And that was very difficult because to go through all of that and think you're going to have your life back and then your life is changing again.
Right.
So I will admit it's been a difficult road, but I go back to I wouldn't be able to lead a group successfully if I didn't understand what it's like now to be a single woman that has
Everything
battled
happens
breast
for a
cancer.
reason.
It
Goes
happens
back
for
to
a
everything
reason.
else.
Yes.
I have to, it's like you have to tell yourself that. You have to believe in that. Because otherwise, I think you would just want to curl up in a ball. You know, life is difficult for everyone. No one goes through life untouched without something.
Right.
You know, for those battling cancer, you know, it's a different journey. But you have to hold on to the hope of, I'm going to get through this.
Yeah.
And, you know, for me, I made a decision to try to help other people.
Yeah.
So,
Well, I actually did. I did go through it firsthand. One of my aunts from Belize, I had to bring her up here, and she was treated at Moffitt. She was here for 9 months. It was the hardest 9 months ever.
Right.
You know, she had actually cervical cancer, and you know, I had to be there for her. I mean, we got really, really close. You know, our faith grew amazingly.
Right.
But just to see that, you know, I'm like, oh my goodness, you know. And then she had to do this brachytherapy thing, and the pain and the
Right.
way she talked about it. I mean, it was amazing. I always commend her for being such a strong woman,
Right.
you know. But she was like, you know, we couldn't do it without our faith,
That's true.
you know.
absolutely.
So
Absolutely.
it goes, like you say, a lot about your thinking, the way you think, your positive thinking. Because she would come home, you know, from her chemo and everything, and we would be there in the house. She's always an upbeat, giving jokes and stuff, and she
Right.
would be just into it again.
Well,
You know,
and-
my boys didn't even realize what was happening.
Right.
Right.
Well, and here's such a good point, is a lot of people say, what do you say to someone that has cancer? You said that, you don't know
Right.
what to say. Or I tell people, if you know someone with cancer and you're thinking about them, we live in an age now we're so connected, is because what happens when you get diagnosed, you're inundated. It's coworkers and friends from afar and family. Everybody's sending you well wishes.
Right.
And then they fade away because they're back to living
Exactly.
life.
Right.
And you are battling cancer. And for me, I refer to it as the glimpse. You get a glimpse of what life looks like without you in it. And it's very sobering. And you can kind of see, well, life is going on, but I'm still sick.
Right.
And so what I'd say, what you can do for that friend or neighbor, if you're thinking about them, call them. I'm thinking of you. Text them. I'm thinking of you. Or stop by. Or say, can I pick up your laundry? People say, what can I do for someone? Because people battling cancer, the one thing they can control is the things they controlled before.
Right.
And so it's hard. For example, I would not give up cleaning my house. And I was sick as a dog. I am 5'8", and I went down to like 98 pounds.
Wow.
I was extremely frail, extremely sick, and no one was coming in my house. I was going to take care of that. And, finally my husband was like, we are getting someone in here. And when that lady came in, I was like, why didn't I do this before? But I didn't want to give up that control.
Right.
And that's the thing. And so people will say, I'm fine, I'm good. But really, if you offer help, offer something of whether it's, let me wash your cars dirty, let me mow your lawn, let me pick up your children.
Right.
Do something with action, but more importantly, don't let them just be a thought.
Right.
Let it be an action.
Understood.
Yeah. And that just
So-
keeps them more involved.
I mean, we're kind of a little bit running out of time very soon, but, we want you to, if you have any last minute advice, anything you want to say, how to come to your
Well,
group meetings, anything that
okay,
we
well, first
think
of all, I
you need to-
really want to encourage everyone. There's so much disparity and so much negative press out there about getting your mammogram. Please, please, please do not let that sway you from doing that. There are so many programs available in the Tampa Bay market that even if you are uninsured, there is Mary Brogan Act. We have programs at our hospital that you can get a free screening mammogram and be aware of your breast health. Do your monthly self-exam. We showed you all how to do it. If you're not sure, get in touch with Kelly or me, and I'll give you a personal demonstration. That's how passionate I am about making sure you stay healthy. Ask your family those family history questions and know if you're at risk for hereditary cancer syndrome, and have that conversation with your family. Make sure you're seeing your doctor annually, and especially for those women in the African American community, don't be afraid of getting your mammogram. It's a squish. It's seconds. Yes, it's not comfortable. It is kind of painful. But, what is the alternative to not doing it? You don't want to be sitting where I am and having multiple surgeries later and looking at your scars every day. Although I do now embrace them. They are part of who I am.
Yes.
And as far as support group, I welcome anyone in Tampa Bay to contact me. Shelby Coriaty, my number is 727-409-6956. I don't hide it. It's on my business cards. If you go onto the hospital website, you're going to see it on our flyer. So if you have questions or if you need some support personally, feel free to give me a call. We'd love to welcome you to our group. We meet the second and fourth Tuesday of every month. So our next support group is actually next Tuesday on the 25th. We'll be at the Life Hope Building at Florida Hospital Tampa. It's 3000 Medical Park Drive, and our group starts at 5 p.m. And we do provide refreshments since it's dinner time.
Ooh, refreshments. Nice.
Yes.
Very cool.
Group kind of goes a couple hours, and we had to say, gosh,
Right.
we're hungry.
I know, right? That's funny. Well, Shelby, thank you so much. I am so happy that you agreed to come and sit with us this evening.
Yes.
You've been amazing as always.
Well, thank you for
and
having
I'm
me.
always happy to see you.
My privilege. Thank you so much.
Thank you very much. I learned a lot. I have had cancer in my family. I've been very close to it, but I still didn't know anything, so to speak.
Right.
Yeah, so thank you very much for that.
Well,
Thank you for coming.
I appreciate it. My pleasure.
Yes.
My pleasure.
Absolutely.
And thank you guys for tuning in to Girl Talk. This is Kera Blades and
Kelly McRae.
remember, you can go on actually www.ivisiontv.net for a transcript of the show. Follow us on Facebook at ivisiontv.net, Twitter, ivisiontv.net,
Instagram.
all of that good stuff. ivisiontv.net.
Yes. We are
And
socially
if you have any
in.
questions about the show, or you want to send something to Shelby, you can actually send us an email as well at info@ivisiontv.net. So, anything else before we?
No, it's such a pleasure to be here. I appreciate having the platform. You never know who's going to be listening, who's going to be watching, and who's going to be saying, wow, I need to take some action tomorrow.
Yeah. And do the breast exam the proper way.
That's right. Do that the proper way.
Yes.
But if you have something that you feel is suspicious, please don't sit on it. get to a doctor. If you don't have insurance, there's clinics in the Tampa Bay area. There's clinics all over the United States. And there's programs out there. There's Susan G. Komen programs out there. There's grants available. Do not let that hold you back from being proactive and potentially saving your life.
Exactly. Exactly. All good advice. That's great stuff. For sure.
Okay.
Yes, because just because you ignore it doesn't mean it's going away.
It's not going away. That's
Exactly.
right. It won't go away.
Exactly.